I have experience in a variety of sports.
Uh-huh.
Played soccer my whole life. I've been climbing for, I guess, 6 to 8 years now.
Hmm.
Getting into golf. But I think the big thing is with any sport or athlete
Hmm.
that you're trying to rehab is just understanding the movement that they have to go through. And the best way to do that is to try it out. So
Hmm.
um, having experience is nice, but as long
Hmm.
as you can kind of understand what type of demand that activity has on their body, you can uh, pretty much come up with a way to at least help them a little bit if you don't have too much experience. But
Hmm.
it's always nice to have someone with some experience to give it a little bit more firsthand input or expertise in.
This is PT Meal Podcast, where we ingest and digest physical therapy information from physical therapists around the world with a Filipino twist. With your host, Johan De La Paz, a Filipino physical therapist who has worked in different practice settings from the Philippines and here in the US. Let's indulge and satisfy our cravings to learn and be inspired.
Hey, welcome back to PT Meal Podcast, a buffet of play, therapies, movement, exercises, activities, and leisure, all packed in a hearty conversation of physical therapy profession and practice with a Filipino flavor. I am Johan De La Paz, your host. So before we start, this podcast is available on your favorite podcast streaming apps in Spotify, Apple Podcasts, Google Podcasts, Anchor, iHeartRadio, Amazon Music, and many more. You can also watch most of the full episodes and live streams on YouTube. If you want to stay updated on fresh episodes, interview snippets, research abstracts, or educational materials, follow the podcast's social media accounts in Facebook, Instagram, LinkedIn, and Twitter. All links and content are also available in the website, ptmealpodcast.com. So now let's go on with the show. In today's episode, we are joined by Oliver Rivera, a senior physical therapist in Shirley Ryan Ability Lab. He's a board certified clinical specialist in orthopedic physical therapy and a fellow of the American Academy of Orthopedic Manual Physical Therapists. In today's conversation, we are going to talk about rehab of rock climbers from a physical therapist who also rock climbs. So neat, right? So welcome to the podcast, Oliver, and I'm glad to have you here at last.
Yeah, thanks for having me.
All right. So I've as I've mentioned before, I knew about you reading about an article that was published in APTA magazine last 2020, and it's entitled "It's Lovely at the Top." And back in 2020, I was starting the podcast, and one of the thrusts of the podcast is to share um, niche practice or population that physical therapists can go into, or to go into and excel or thrive in. And reading about that, I was like, wow, this is so interesting because I have friends who are into climbing, wall climbing, rock climbing, bouldering and stuff. I was like, this is so apt because I have friends like that, and me as a physical therapist friend of theirs, they would ask me about certain injuries that they uh, uh, incur, but I can't relate to them because there's a difference in I'm not familiar with what they're saying and in what their the requirements of rock climbing. So this was really interesting for me reading about it in the article. But before we really dive in, could we start with how you became a physical therapist? Uh, what made you decide to become a physical therapist first?
Absolutely. So we'll go back to, I guess, in high school when you're trying to figure out what you want to major in when you're an undergrad. And as a 18-year-old kid, I had no idea what I wanted to do with my life.
Mhm.
And I was good at chemistry, so I decided to major in chemistry,
Mhm.
and with the goal of being a pharmacist because I had a couple aunts and cousins that were pharmacists. I'm like, sure, that sounds like something that can make me a decent amount of money and not cause too much stress long term.
Uh-huh.
And then in undergrad, I was a terrible student because I was taking all these chem classes. I take up to Calc 3, realized I hated it all. And then when I finally shadowed my cousin, my aunt, and saw a couple other pharmacists, realized this would be the most mind-numbing, terrible job in the world. No offense to any pharmacists out there, but I just knew it wouldn't be for me at all. So didn't do too well in undergrad until I kind of decided to shift towards physical therapy. I was a high school athlete, got hurt plenty of times, been to PT, and I'm like, I could probably do this. It seems like a good gig for the long-term future. And then finally going to get some observation hours and seeing what they do, it just seemed like a perfect match where I could still be in healthcare. I still wanted to help people, so I could go down that avenue, but get to do things that I was more interested, like being active, helping people move and exercise. That was way more appealing to me. And then you also get that personal one-on-one interaction with a patient that a lot of healthcare providers don't get in their fields. So once I decided to take all the prereqs for physical therapy school, I had a low GPA, so I had to retake a lot of classes to try to bump that up. And I think I barely made it out of undergrad with a 3.0. So that took a lot of hard work, but I knew it wasn't enough. So I decided to take a gap year, worked as a physical therapy aide for one of the big chain outpatient clinics, which is a really good experience for me because I got a lot of experience in multitasking with many different patients at once, which I probably wasn't supposed to do, but was able to communicate well, got experience with directing people and exercise and giving good cues and all that before even becoming a physical therapist. I think it took me 2 rounds to get into school. And again, it was just because of that low GPA. But I finally got in 2014 and went to Toro University, Nevada. And it was there that I got surrounded by rock climbers. So I'm from Chicago, and there's not a lot of mountains or boulders or anything else to climb out here. Right. You have to go either 2 hours north of Wisconsin or 4 or 5 hours south of Southern Illinois. But most of my classmates were from either Nevada, California, Utah, and they all had a lot of outdoor recreational experience.
Right.
So one classmate in particular I sat next to every day, he was from Washington, and he always was asking if I wanted to go to Red Rock to climb with him. And I had zero experience, but finally gave in one day, said, yeah, let's do it. And then immediately fell in love with rock climbing. So from there, having outdoor climbing 20 minutes away from my school, as well as an indoor gym being 5 minutes away, kind of just pushed me into falling in love with rock climbing.
Gotcha.
But yeah, from there, I knew I just wanted to go to outpatient orthopedics. So set up a lot of my clinical rotations in outpatient orthopedics. One of my CIs, who's probably the biggest influence on me, was orthopedic certified specialist. He had his OCS. He did a residency program, and it was him plus one of my professors that really pushed me into wanting to do a residency. And that's when I applied and got in and went to the University of Illinois, Chicago, and completed their orthopedic residency program. And in that curriculum, we have to do a capstone project. So I did a quick lit review. There was some research out there on rock climbers, but not a lot. So that's when I decided to do this full, I guess it was an observational study where I assessed a bunch of rock climbers. I think at a sample size of 100, looked at
that's a lot.
5 to 10 different variables, and try to run my own data analysis and realize how in over my head I was during that whole project. But luckily I had some help along the way, and finally had something tangible to submit for a conference, and found basically no correlations with kind of my hypothesis there. But that's where it kind of really pushed me to, again, dive into rock climbing a little bit more, and then dive it into the research world as well.
Oh, nice. What did you find out in your capsule project?
Yeah, so
I was curious.
I am very interested in return to sport and injury prediction. So we know a lot about ACL is probably the big one out there in terms of injury prediction, and we mostly know that most injury predictors aren't that good in terms of letting us know if someone's going to get injured or not. But I was curious to see if there's anything out there with rock climbing, and there wasn't really when I looked when I did my lib review. So I decided to do a study to see if there were any injury predictors for recreational rock climbers in the wrist and hand. So again, I took 100 rock climbers out of my local climbing gym that I climbed at.
It's
I
amazing.
measured
100
Yeah, it
participants.
was nuts. I couldn't believe I got that many, and how I got that many. I didn't. It was a blur of a couple months. But I got grip strength, wrist flexion, wrist extension strength, finger length, finger width, ape index, which is your wingspan to height, and then gave a subjective questionnaire to see what their level of climbing, their ability, their frequency, what type of climbing they did, and then their injury history to see what types of injuries they've had. And then we ran a whole statistical analysis and found that the only things that correlated with injury were climbing experience, so how long you've been climbing for, as well as climbing difficulty. So basically, if you climbed for a long time, you probably had a wrist or hand injury. And then if you were climbing pretty tough routes or hard routes, you had most likely a wrist or hand injury. So nothing too substantial that was predictive besides being exposed to rock climbing for a long time.
That's amazing. So these are recreational climbers, not competitive climbers.
No. Yes, they're just recreational climbers right now.
Oh, that's amazing. So I read in the article that when your colleagues would what do you call this, would refer rock climbers or patients that are rock climbers to you, do they know that you're rock climbing? That's why they refer patients to you.
Yeah, I guess I'm pretty vocal on the things I like to treat, and in our clinic we all know what each person likes. So I think kind of word just gets around, and we have a good idea of what each therapist in our clinic treats. But the big thing, what kind of spread for me, was word of mouth between patients, because in Chicago there's only 3 or 4 gyms, and each of those gyms has a couple locations. So if you treat one, they'll tell their friends, and then
to see you
all of a sudden, exactly, all of a sudden you're seeing a couple of them. So that's how it kind of worked out for me.
But in truth, you're not really just seeing rock climbers. You're not there just to see rock climbers. Okay.
Yeah. So I have experience in a variety of sports. I played soccer my whole life. I've been climbing for, I guess, 6 to 8 years now. Getting into golf. But I think the big thing is with any sport or athlete that you're trying to rehab is just understanding the movement that they have to go through. And the best way to do that is to try it out. So having experience is nice, but as long as you can kind of understand what type of demand that that activity has on their body, you can pretty much come up with a way to at least help them a little bit if you don't have too much experience. But it's always nice to have someone with some experience to give it a little bit more firsthand input or expertise in.
Plus you understand their jargons, whatever
exactly
they're saying. Aside from that, what are the advantages of treating rock climbers, being a rock climber as well?
Yeah, so I mean, you hit the nail on the head that knowing the jargon. In one of the studies that I'm currently writing the manuscript for that project, for that research study, and one of those studies cited that I think it was over half of recreational rock climbers that get injured don't seek medical treatment because they feel that their healthcare provider doesn't know about rock climbing. So that's a pretty big number right there. And I know severity of the injury may play a factor if they think they're going to be fine without seeing anybody, but still that's a distrust almost in your healthcare provider is a reason to not go see them. That's a pretty big thing. So I think when you find someone that, or when a patient finds someone that they know at least has some experience, that's the person that you want to go to. If you're a musician and you saw a PT that specializes in musicians, that's the person that you want to go to. Right. So I think for me, knowing that lingo, knowing kind of the demand that they have to go through, that it's just not all arms, it's how you use your legs. It's how you can control your center of mass along a wall, what a dyno actually feels like when you're jumping
with
from
what?
one hole. like a dynamic move. They call them dinos.
Okay.
Yeah.
I thought you were talking about dinosaur.
Okay. Yeah. But just that's the specific fear
Mhm.
and kind of that mental challenge that you have to overcome with it. I think it helps, and I think that's why the majority of people that rock climb kind of seek me out that I've treated, just
Mhm.
because of that familiarity with what they have to do.
Right. I think it's like what you said, like if a musician or dancer would be injured and would seek someone who understands what they're doing,
Hmm.
musician or a dancer as well, similar to people who lift, they would seek someone who knows how to lift as well. So same thing. When you're seeing rock climbers and their injuries, what are the common ones that you usually see from rock climbers?
Yeah. So typically, it's like the big ones, obviously, like a pulley tear. So when someone tears one of the pulleys that's holding down their flexor tendons in their fingers,
Oh, okay.
that's probably the biggest injury that is associated with rock climbing.
Mm-hmm.
Those are always tough because if it's fully ruptured, like there's not much you can do in terms of rehab, besides strengthening everything else around it,
Mm-hmm.
and then kind of managing pain. But in addition to that, you can see like TFCC tears at the wrist. You can see flexor or extensor tendinopathies at the elbow. There could be neck pain associated with constantly having to look up at your next route or having to belay someone,
Mm-hmm.
just watching them move. There can be rotator cuff strains, ankle sprains from falling. My last one was actually an ACL tear when she fell from a
Oh
bouldering
wow.
problem. So I was rehabbing her, trying to get
Uh-huh.
back to climbing. So I think it's a wide variety just because of the nature of the sport, that it's not just using your hands, but it's also kind of the falls that you take.
Mm-hmm. Is it mostly the upper extremities that
I
they commonly injure?
Yeah, I think that's probably in climbing as a whole, it's the upper extremity that's injured the most. In
Mm-hmm.
bouldering, because you're landing on a hard surface, you can
Mm-hmm.
see a lot more knee and ankle injuries.
Mm-hmm. For the one that you said, like the rupture of the extensor, do they have to undergo surgery to repair that?
I think it just depends on the severity of it. So if that flexor tendon is fully bowstringing and that affects kind of their grip, that may
Mm-hmm.
be an option. But
Mm-hmm.
I couldn't tell you the prognosis of that off the top of my head,
Mm-hmm.
because I've never specifically dealt with that.
Mm-hmm.
So for me, it's been typically just seeing like minor strains of it, but I've never treated someone that has like that full rupture of that flexor or that pulley.
Mm-hmm. Gotcha. So as a rock climber yourself, have you encountered any um mistakes or uh old beliefs of rock climbers in their training that could be harmful? Though we said that there's no predictive uh factors that would say that you're going to be injured in this, but are there anything that rock climbers do that can possibly lead to an injury in their training?
Um, it would probably be volume management.
Mm-hmm.
Like most climbers, like your recreational climber, they're just doing it to have fun. So
Uh-huh.
if they're going out every day to the climbing gym or to your local crag with their buddies and not really realizing how much strain they're putting on their body, that's where those overuse injuries come in.
Mm-hmm.
So it's kind of recognizing when your body's telling you that you need a rest day or two.
Mm-hmm.
So that's probably the biggest thing. Now,
Mm-hmm.
there's a lot of like myths out there in terms of uh, like you always need to train your wrist extensors and finger extensors to help combat how much flexion you're always going into. I don't
Oh.
necessarily buy into that too
Mm-hmm.
much, just because the natural position of the wrist, you're already in wrist extension, so those wrist extensors will probably be ample strongs. And I think
Mm-hmm.
most injuries occur more due to overuse versus someone having significantly uh, more strong wrist flexors and finger flexors versus the extensors. So
Mm-hmm.
that's kind of my 2 cents on that.
Mm-hmm. So is it like when you train when rock climbers train, do they have to focus more on their uppers in general than lowers, or
It's kind of the
everything?
whole, it's kind of everything.
Uh-huh.
Because again, it's going back to just watching how they move. And the most common thing is someone doesn't know how to stabilize their scapula, because then that affects how much load goes through their fingers, their finger flexors, and
Right.
that affects how well can they stabilize their wrists.
Uh-huh.
And then if they can't stabilize their scapula, does that mean they have a weak core and they don't know how to control their trunk, and that affects how they move their lower body? So that might
Mhm.
add strain to the knee or the ankle. So it's kind of tough to generalize it just to one region. That's hard, and I think that's like the key to any sport is you have to watch the whole package,
Mhm.
versus just like a pitcher like focusing on their elbow or shoulder, where really now we know with pitchers that it's really how the whole lower chain works through that throwing motion that's the most important.
Mhm. Is it in training? Is it more um, doing a specific activity more often, or doing different activities like not just rock climbing but other sports as well?
um I mean, I think most athletes that specialize in one sport, whether professionally or
Mhm.
recreationally, always benefit from some type of cross training
Mhm.
from another activity. So like runners doing lateral work, or um, like climbers doing like strength and power work.
Mhm.
Um, so I'd probably say, what was your question again? Sorry, I kind of lost track there.
Is it for training? Is it more beneficial to do specific um, training that is involved in rock climbing, or is it more beneficial to mix it up to not just tasks that are involved in rock climbing, but also engage in other sports?
hmm
Mhm.
So I think it always depends on what that kind of crux move is. So
Mhm.
what that hardest move
Mhm.
of where you're kind of plateaued out there. So if it's just like a core strength problem that you feel yourself not able to control your center of mass on the wall and you're flinging off a wall, it
Uh-huh.
could just be you need to do some more core strengthening, whether it is planks or different types of plank walks, or you're actually on the wall just working on um, keeping that trunk and center mass close to the wall.
Uh-huh.
But if it is like a specific hold, like you can't hold on to a razor thin crimp,
Uh-huh.
you might just need to practice holding on to razor thin crimps for a while before
Mm.
you're able to tolerate that.
Mhm.
So it kind of really just depends on what is that barrier to you breaking through that to that next level of climbing difficulty, that next grade, or to that project that you're working on.
Mhm. And I see my friends or climbers, they would practice on this I don't know, on the wall. They're just holding onto with their fingers and just
Yeah, the
hanging there
hangboard. Yep,
as long as they can.
exactly. Yeah. So that's like another method there to
Mhm.
work on that grip strength. So
Uh-huh.
yeah, it really just kind of depends if like what that barrier is to
Mhm.
whatever problem or
Mhm.
grade you're working on.
And someone would know that once they start uh
hmm
doing or rock climbing, they would notice, oh, this is where I'm bad at. This is where I should work on that.
Yeah, absolutely.
Have you encountered any like beginners who just started in rock climbing that are encountering injuries? What do they usually complain about?
Kind of those overuse injuries where
Overusing.
it's yeah, it's just they kind of uh, fall in love with it and just go every day, like I said. And
Uh-huh.
um, like for those easier grades, like for bouldering, like those V1 through threes, you can get away with doing with climbing every day because there tend to be easier routes, just learning how to like kind of move your body on the wall.
Mm-hmm.
But once you start getting up to like a V5, 6 range, and you get a lot more demanding moves, whether it's a small hold, like a higher step, a smaller foothold to go onto. It just
Mm-hmm.
takes a lot more demand from the body, and that's where you start to see some bigger injuries. But for the most part, for those beginners, yeah, it's a lot of just overuse injuries
Mhm.
where they're tearing some skin off. They
Oh, wow.
have some, yeah, they have some sore like forearm extensors
Uh-huh.
and flexors, sore fingers, or like a sore shoulder just because they're using all their arms, not using their legs enough. So I think that's
Mhm.
kind of the biggest thing with new climbers.
Mhm.
That's why I stress you just have to learn technique. That's the biggest thing to do it
Uh-huh.
well.
And then for those overuse injuries, it's just knowing your natural history, right? Like tell them to rest and active rest and stuff like that.
Yeah, for the
You're,
most
you're
part, it's just
ready.
exactly, yeah. If something's more serious, then they
Oh,
may need a little bit more formal evaluation and
right.
treatment. But for the
Mhm.
most part, with those overuse injuries, it's just kind of taking a couple of rest days.
Because I think if they like the sport so much and they're afraid that if they injure something that that you might say, oh, you have to totally stop it. You can't
Mhm.
continue it.
Yeah, I think in my point of view, like I never want to tell an athlete to stop.
Mhm.
It's like a runner. If you tell a runner who runs 50 miles a week because they have shin splints or ankle pain to stop running, they're not going to
Mhm.
stop running. There's like a 99% chance that they'll keep on running and a 1% chance that they'll actually stop. So it's
Mhm.
all about educating the person on why that's injury is occurring and giving them different options on how to modify that task.
Mhm.
Whether it is volume management, whether it is some type of mechanical change you're making to the gait, or something else, trying to strengthen or stretch something that may be affecting how they run and that pain, or in this case, how they climb.
Mhm.
So I think, yeah, for the most part, having them rest a little bit, but still giving them some encouragement that you can still climb. It's just how does your body respond to this, and it'll
Mhm.
naturally tell you if you need to kind of give yourself rest or if you need, uh, I guess, a more formal plan of care in terms of rehab.
As a rock climber yourself, do you also provide some input on how they should train when you see them as your patient?
Oh, absolutely, yeah.
Mhm.
So I get that all the time where asking me, I guess, what grade they should climb at for that week, what types of routes to try and what to avoid in
Mhm.
terms of different moves that they have to do. So yeah, it's kind of all climber dependent.
Mhm.
Thinking about my last one that I treated, my ACL reconstruction, like her big deficit was any high steps on that involved side because she still didn't have end range knee flexion. So when you do a high step,
Oh,
you have to move your weight over it.
right.
That's all that pressure on that knee in a flex position.
Mhm.
So uh, that's what we were trying to kind of ease her way into, is practicing that move from not so high of a step if she can avoid it on a route. And if there was one, kind of just forget that route, but also working on that specific task, like having her do a high step on like a box and then gradually moving her weight over to kind of
Mhm.
help change that tissue to help her tolerate that move. So
Mhm. Yeah, you explain that really illustrates the advantage of knowing what the sport is, so that you know how to progress the patient in their task and their exercises and activities.
yeah, absolutely. And I lucked out that I tried a bunch of different sports as a
Mhm.
kid and as an adult because I get to see a lot of different athletes in my clinic, which is nice.
Mhm.
So it keeps it interesting and fun, keeps me
Uh-huh.
thinking.
Right. Um, you mentioned earlier like bouldering, rock climbing, or wall climbing as well. For someone who's starting to like the sport, which one should they start first or try it out first?
Ooh, that's tough
Uh-huh.
because I'm personally afraid of heights,
Uh,
and that's why went into rock climbing to help face my fears.
uh-huh.
That didn't help. I'm still afraid of heights. But I was just more drawn to bouldering. I felt like it was
Okay.
a little bit less technical, a little more athletic. You can get away with less technique and be a little bit make up for it with a little bit of power and explosiveness. So that's what I was drawn to. But
Mhm.
really, it's just whatever gets you like on a wall or on a
Uh-huh.
rock.
That's
Um,
surprising because I'm when I watch my friends uh when they go bouldering, and everyone's like doing trying to catch the other person. I was like, and you're gonna fall on this mat with uneven surface. I was like, that's so dangerous.
Yeah. Yeah. And the mat's not soft either.
Uh-huh.
Those pads aren't soft. They're pretty
Uh-huh.
firm.
So like
Um,
that's scary. I mean, that's scary for me. I'm scared for them, but they were like, I don't know. They can fall on their feet, they can fall on their hands, and they know how to fall.
exactly. And that's one of the things I taught my last patient who was going through an ACL tear is that when you fall, like you have to know how to do it. So
Uh-huh.
that's one of the big things that most, I guess, new boulderers have to learn is how to properly fall.
Mhm. Fall like
Um,
a cat.
exactly. And then roll onto your butt because yeah, you don't want to land on your feet like I guess the superhero landing. That's not a good thing for your legs.
um, so in treating rock climbers, what intervention do you usually um use? You mentioned an important integral part of the treatment is patient education, but other than that, what other techniques
Mhm.
do you personally use when you see rock climbers in general?
Yeah. I think my background, especially after I did my fellowship program, is kind of Maitland based.
Mhm.
So it's a lot of finding a functional movement. Uh, so for rock climbers, seeing what actually causes them the problem, whether it's pain or some type of limitation, and then trying to change that functional movement and then seeing if that makes a difference. And then from there, kind of carrying that forward with my exam and then basing intervention on that. So it's tough to say like what's the one thing
Mhm.
because sometimes I'll go manual therapy with joint mobilizations
Mhm.
or manipulation. Other times it's neuro rehab, or other times it's just you're weak and you need to get stronger or you need to stretch something.
Mhm.
So for me, it's really just that functional assessment and
Mhm.
then trying to add different things during that task to see what can change. So, like for example, if someone has like shoulder pain when they're on the wall, that is kind of the back of their shoulder blade. You got to figure out, is that truly like a rotator cuff problem? Is it a scap problem? Is it coming from the neck? Um, so if I'm seeing them kind of hang from a pull-up bar and replicating some move that bothers them with climbing, having them move their neck around to see if that changes their symptoms, adding a little bit of support to their scapula to see if that changes their symptoms, trying to change uh, some type of activation with the rotator cuff to see if that changes your symptoms. So I would say, like technique wise, there isn't really one thing. It's really just kind of my clinical assessment that is like the key piece of how I treat
Mhm.
not only rock climbers but all of my patients.
Mhm. And when you said functional assessment, you ask them to do the thing that triggers
Yeah,
the pain.
my basic question is, what's the worst thing you can do right now to light this thing up? Whether
Uh-huh.
it's bending forward, doing a squat, doing a push up,
Mhm.
hanging from a hangboard,
Mhm.
or landing or jumping off a box and landing. So it just kind of depends on what brings them into me and what they think is going to be the thing that's worse for their pain.
Mhm. Do you have a wall in your clinic where you can ask, okay, show me where the move that makes it worse or no?
We have a pull-up bar. We have some rock rings. I don't have a hangboard in there yet, but yeah, we have some stuff that helps recreate some of those scenarios.
Uh-huh.
Yeah,
That would be amazing if you're like really specific. Okay, show me what move you triggers the pain.
exactly. Yeah, yeah. You know,
Well,
we make do with what we can. I have them describe it to me, and then it really tests the creativity
mhm, mhm.
that we have.
Okay. Um, do you also provide your patients with how they can really go back to specifically to sport, or do you leave that to their coaches or trainers?
I mean, I think about it like I do, like help guide
Mhm.
them on the full return to sport.
Uh,
Um, so we have different battery of tests that we have
hmm,
for different athletes. So like I have a whole lower extremity return to sport assessment. I have a thrower non a thrower return to sport assessment and a non-thrower upper extremity return to sport assessment. So whether they go through the full gambit or I take pieces of that, we take those different aspects of those tests into consideration, as well as making sure that they are able to do any of the tasks that may be demanded or asked of them during the sport, such as rock climbing, into consideration before we kind of clear them. So, for example, for my last patient who was coming back from the ACL tear, I went with her to the climbing gym and watched her climb different grades that were in her capability, and then tested her on her, does she know how to fall? How does she tolerate that high step that she had so much difficulty with? Like, how's her footwork? How's her core control when she has to do a far reach, whether it's the foot or the arm? So, yeah, it's I'm a full service clinician from initial post-op to return to sport.
Right. You even went to her gym. That's amazing. Okay. That's something that not many physical therapists would do. Like, if you're not really like a team physical therapist, you just see your athletes in the clinic, the clinical setting. But that's amazing. What's your opinion on kids starting specifically on one sport, like here in rock climbing?
I think in general, especially now that I have a son, a 14-month-old right now, like, I think introducing them to sport at any age is great. But I mean, the younger that they can be introduced to that sport, the better that they're going to be able to perform it as they get older. So thinking about myself, I wish I got into climbing when I was like 10 or 5, because I mean, as a kid, there's a lot less fear. Moves become a little bit more natural, and it just becomes a little more what do you want to say? I guess, natural is the word for you. But on the flip side of that, I think, like most of the literature states, I'm not a proponent of one sport specialization, especially if it's year round. Especially with kids, if we're thinking about kind of their skeletal maturity and the demands that one sport would have, especially if they're doing it year round, that's just gonna be it's not gonna put them in a good spot to succeed in that sport long term. So I mean, thinking about it today, like, I am seeing one baseball player who's 12 who has little league shoulder, so that growth plate is kind of gapped right now, is how much they've thrown to try to get a faster pitching speed. So overall, I think introducing sports to kids at an early age is great, but you have to be smart about how much they do. It's like an adult with an overuse injury. Like, I think I said earlier that volume is the key thing there. And it's the same thing with not only our adult athletes, but also our adolescent and pediatric athletes. So I think varying it up is probably the best way to go.
All right. Yeah. Because I have my friends are rock climbers, and their kid is now competing in rock climbing as well, and getting what do you call this, awarded for it. And when she was young, she would see her parents rock climbing, bouldering and stuff, and she began to like it as well. But growing up, she was playing other sports as well. She was playing like, I don't know, the Ninja Academy. She was doing that. She was also doing basketball. She was really a sporty kid. And now I think now that she's more focused on climbing, that's more on that's where she's focusing more of her time, but she still plays other sports on the side as a recreation, just for fun.
Yeah. I mean, I think the end of the day, as long as they're having fun doing it, that's the most important thing.
Right.
You never want to push them so much that love is kind of lost and gone, because that's kind of like their whole thing is one sport. So as long as they're having fun and enjoying it, I mean, that's all really that matters.
Right. So you mentioned in our email exchange that you expanded to more sports now, not just rock climbers as well. So how is that? How is the transition on seeing more patients in different sports, and what played a big part on that?
I think sport has been was one of the big drivers of me getting into physical therapy. So I always knew I wanted to treat athletes.
Mhm.
I knew I never wanted to be a team physical therapist because the hours sound terrible. Um,
But some people
but
like it.
exactly, but not for me, especially not at this point in my life. I think my wife would kill me if I was gone for, I guess, half the year.
Yeah, yeah.
But at the end of the day, I think it kind of goes back to I talked about what I learned in fellowship is just how can you appropriately analyze someone's motion and movement, and what can you do to influence that movement for the better in the presence of pain or type of dysfunction. So with my background, like just playing a lot of different sports, I think that translates well to the majority of sports out there. So as a soccer player, like and track athlete, played basketball, played volleyball. Kind of that agility and cutting translates to most of those lower extremity sports out there.
Mm-hmm.
And then being almost a nerd about biomechanics when I got into golf, like the golf swing is the most fascinating and intricate thing out there in terms of how many moving parts there are and how many things kind of play into it. But with each of those sports and activities, if you can kind of break down someone's movement and kind of think about or generate a differential list of all the possibilities that might be occurring causing that pain or dysfunction, then I think then from there, it's just about ruling each of those causes out and kind of narrowing that list. So for me, it's just fun to do because I like a PT session is a lot more interesting when you get to see someone, I don't know, do like hang from a hangboard or kind of do a ladder drill or kind of pitch a ball versus watching someone do a 6-minute walk test or some of the other less fun assessments that us PTs can do. But pretty much the method is the same, whether I'm analyzing a climber, a soccer player, or a thrower, or a musician, or anyone in between. So it's just kind of breaking down that motion that is giving them the most problems.
And it's not, I guess, not as monotonous as other population would be, because you're when you're seeing different athletes, you have to be in their world, so to speak, to really help them. How big or how I mean, what do you call this? Because we were talking about athletes, so and getting them back to sports. So how what's the part of strength and conditioning play in your intervention?
Yeah. I think strength and conditioning, once I have that athlete up to a point where they can kind of take it to their coach or trainer and they're kind of meeting all my criteria to return back to that sport, then that's kind of when I leave it to that coach or trainer to kind of take over. And there's always communication between me and that person on what that next step is for that athlete. But when we're transitioning from that athlete having initial pain, and then getting them to be able to tolerate some of those more sport specific movements, I'm kind of taking that same role as that coach or trainer, and you need to be able to do this task to meet these demands so you can do that motion well. So if it's like a climber who's bouldering and they always have shoulder pain whenever they do that dyno or that dynamic move where they have to jump and catch that next hold, I'm thinking of things to make that task easier. So they need to have a lot of shoulder stability and scap stability and a strong rotator cuff to be able to absorb that shock. They need to have a strong core for that upper extremity and lower extremity to work off of. They need to have explosive legs to be able to not be so pulley with the arms when they're reaching for that next hold. And they need to be able to coordinate that whole system well,
Mm-hmm.
and have the dynamic balance, to be able to tolerate like all of that. So that's kind of the most exciting part for me as a PT working with athletes, is that once you kind of solve that pain and you get to get creative and fun with it, that's where I have the most fun.
Mhm. Is it when you were talking about, that all that stuff, I was like, okay, there's a lot of terms there not familiar with, but is it easy? Is there an easy buy-in when you talk about those stuff
Oh,
in with your clients, your patients?
100%. I mean, it's like anything. Like if
Because they know what you're
like you
talking
take
about.
exactly, like they're actually using the lingo, and a lot of my patients that I've worked with, that are at the gym that I was a part of, they would see me there, so it was a familiar face for them.
Uh-huh.
So yeah, it's so easy for buy-in if you can at least talk the talk. You
Uh-huh.
don't have to necessarily walk the walk, but if you can talk the talk and
Uh-huh.
understand the lingo, and again those demands that they have to go through, it makes buy-in so much easier, and that therapeutic alliance just goes through the roof.
Right, right. So, what would be your advice to physical therapists who are thinking about going into a specific population or practice? May not be rock climbers, but thinking about where they can excel at. Probably they know a sport that they want to go into, and focus on those uh, population. What advice can you give them to excel in the area?
Yeah, I think just uh, coming at it from a population perspective, you have to know like that population. So you have to be where they're at. So if you're wanting to treat climbers, like the best way is to have exposure to them. So be part of that gym, offer that gym different educational series, simple stuff, whether it's like finger health, wrist health, elbow health, something
Mhm.
injury prevention wise. Um, you have to be a familiar face. You have to know kind of what you're talking about with that sport. And you have to show that you're knowledgeable.
Mhm.
But for anything really, it's doing the basics well. So as PTs, we're movement experts. You have to be able to analyze that movement um, very well and efficiently. You have to know every single potential diagnosis that might be happening.
Mhm.
And you have to have a little background in pain science, because some athletes are pretty straightforward, other ones can be head cases, and that all affects their perception of pain. And you have to be able to know how to kind of progress that athlete to those different levels based on where they're at in their stage of healing.
Mhm.
So a lot of different things there, but I think the number one thing is just doing the basics really well.
Mhm.
And that's what my residency training taught me, and that's what my fellowship training taught me is there's no really secret to it. There's no like one system that answers all. It's just about knowing how to assess someone very well and to make sure that you're treating the right thing.
Mhm. Right. Good. So Oliver, thank you for coming to the podcast. We're nearing our end, and thank you for sharing your experience in treating rock climbers as a rock climber yourself. I just have my last bites, my last questions. It's not related to our topic anymore, but it's a question for you. So my first last bite is, what's your personal recipe for success?
Um, I think for me, I knew that where I wanted to go, and I kind of had an idea of how to get me there. So it's about recognizing that I knew I wanted to be a very uh, well-rounded orthopedic outpatient therapist, and I
Mhm.
also wanted to do well at sports. But I knew I needed to um, have the fundamentals down. So I decided to do a residency. And coming out of residency, I was like, I know a lot, but I don't think it's
Mhm.
refined enough yet. And that's when I was like, I need to do a fellowship.
Mhm.
And that's kind of what made me do or feel like I was really proficient with those basic assessments. So it's finding that path that you think is gonna kind of get to where you need to go. You gotta be able to recognize kind of those different steps
Mhm.
that you need to take.
All right, good. Because there's a lot of people that they know where they want to go, but don't know how to go there. So for
Yeah,
you,
absolutely.
what helped you or who helped you in finding that way?
Yeah, I think you have to get to know people that are there of where you
Mm-hmm.
want to go and kind of figure out what was their journey. So
Right.
one of my residency mentors, like he was probably one of the smartest guys I've ever come across. And I asked him like, how'd you get to this? And he told me it was this fellowship program with this one person,
Mm-hmm.
Dr. Carol Courtney. And I did that 2 years ago and kind of completely changed my practice and
Mm-hmm.
how I assess and treat all of my patients. So it's figuring out like who is where, who's there, wherever you want to be,
Mm-hmm.
and kind of figuring out what did they do and how can you kind of either replicate or at least take something from kind of their own journey.
Right. Yeah, amazing. I like that. All right. My second last bite is how do you continue to sharpen your knives? Are you doing it
For
yourself?
me, yeah, I'm fortunate where I work is that with that I get to do a lot of different things.
Mm-hmm.
So not only do I treat patients from geriatric to adolescent to pediatric, from athletes to sedentary individuals and complex and chronic pain. But I get to do other things like I was uh, a medical assessor for the US Adaptive Open
Wow.
for golf
Mm-hmm.
last summer. And I do a lot of classification and eligibility assessments for golfers with disabilities. Um, get to run a couple or participate in a bunch of research projects. I am adjunct faculty for one of the physical therapy schools in Chicago, and be around students that ask a lot of questions. And then I serve as a mentor for Northwestern's orthopedic residency and their fellowship program. So it's being around individuals that kind of like mine and help push you to stay
Mm-hmm.
sharp and kind of keep you on your game. And I think that's
Mm-hmm.
what helps me stay sharp is that
Mm-hmm.
I have to help influence some of these like students and residents and fellows in training
Mm-hmm.
and help them grow. And that definitely keeps me sharp and knowledgeable.
All right, I like that. All right, last bite. What are the three ingredients? Can be your motto or a trait, a characteristic, a verse, a quote, or whatever that you carry with you every day of your life. Or in short, what are the three ingredients that make up Oliver?
Gotcha. Um, yeah, that's a tough one, even though it's about myself. Um, I think for me, one of them is since I did two post-professional programs, one of my thoughts that my wife always jokes about with me is that you can do anything for a year, no matter how hard it is. You can do anything for a year. So yeah, fellowship's no joke. It was the hardest year of my life, but I knew it was just a year, and there was an end date, and I would come out better on the other side. Um, the other thing is another one is, I mean, you have to put in the work yourself.
Mhm.
Like if you feel like you need to know more about something or you know where you're deficient in a particular area of your practice, like you can ask people, but really no one's going to do it for you. You have to figure out what resources you're going to learn from or what path you're going to take.
Mhm.
And then I think the third one is going back to you just have to know how to do the basics really well. There's plenty of techniques out there and different assessment methods, but if you don't know how to do the basics well, everything else that stacks on top of that isn't going to go well for you.
Mhm. Gotcha. You can do anything for a year, put in the work, and know the basics really well. How
Yeah.
long is a fellowship? It's 1 year or
It depends on
2 years.
the program, but mine
Okay.
was 12 months,
Oh,
1 year.
okay.
Yeah.
And residency is a year as well.
Yeah. Both of my programs were 1 year. They can vary in length, but
Uh-huh.
both of my programs were a year.
Wow. Okay. Yeah. That's great. All right. Again, thank you very much, Oliver, for being in the podcast and at last coming over here and sharing your experiences with us and your thoughts. For those who are listening, catch the next episode of our of PD Meal podcast. So yeah, thank you very much. I'll see you again. Hi, everyone. While I was editing the podcast, I realized that I forgot to ask Oliver the takeaway question, which was the one that he would like you to remember from this episode. Um, so I just wanted to share what my takeaway was in our episode. If you listen carefully to what Oliver said in the whole conversation, you'd really notice his expertise on the subject matter. But he also said that if you're not able to, if you're not familiar with the sport or the activity, or what the client is saying, as long as you got your basics down, you'll be able to help your client or your patient. So your assessment, your basic movement patterns, functional assessment, and stuff like that. And my second takeaway here is, if you're going to a niche practice, it's better to go to where you're passionate about, something that you're doing as well. So listening to Oliver in that whole conversation, he was saying about Dino V1 to V3 or V something. It just rolls out of his tongue. And if I was a rock climber, I would really go to someone who knows how to rock climb, because they are experienced in that activity as well. So I feel that they will be able to help me better. So same goes, like if we're talking about like other sports, um, other activities like dancing, being musician and stuff like that. So there, if you're going to uh go to a niche practice or a certain population, make sure that you're familiar with the jargons, with activities, even if you're not engaged in that certain sport. At least you know all of the mechanics, biomechanics of that sport, of that activity, so that you'll be able to analyze, assess better. You get your fundamentals, your foundations, your basic assessment down, then and your genuine sincerity to help your patient. Then I guess that's the most important part of it all. Okay. So again, I'd like to thank Oliver again for being in the podcast, and he's the one who reached out after 2 years of me of my email. I mean my message, just in his inbox, in his LinkedIn. I really appreciate him reaching out again and accepting my invitation. So watch out for our next episode, um next week. All right, see you again.